Hello, my name is Elizabeth and we will be presenting HIV and AIDS. Next slide. HIV originated from chimps. There is suspicion that it was because hunters ate chimpanzee meat once not too long ago. The virus was first located in Africa and then spread all over. Next slide. HIV is defined as human immunodeficiency virus. It's a virus that attacks the immune system, specifically attacking CD4 T cells, which are white blood cells. Next slide. HIV advances to AIDS, which is acquired immunodeficiency syndrome. People who are diagnosed with this are people who get diagnosed with this once their CD4 T cells count is lower than 200. Next slide. HIV structure consists of 2 strands of RNA, 15 types of viral proteins, and proteins left over from the last infected cell, surrounded around by a lipid bilayer membrane. These all allow the virus to take control of the immune system and force their own cells to be copy the virus. HIV is sexually transmitted, but also spreads from blood or from parent to child in pregnancy. HIV has 3 stages: acute, chronic, and AIDS. Next slide. Unfortunately, there is no cure for HIV, but it can be managed with treatments. The first stage is acute HIV infection. People who have acute HIV infection are highly contagious. And people who may have contracted this disease may feel as if they have the common cold or flu. But not all people have these type of symptoms. HIV is very contagious in this stage. Next slide. Chronic HIV is the second stage for HIV. HIV is very active and still considered highly contagious in this stage. Next slide. This is the final stage of HIV. This is known as AIDS. AIDS is defined as acquired immunodeficiency syndrome. This stage is the most severe. This is where the immune system has been damaged beyond repair. This is where the CD4 T cells have dropped below 200 cells. People with AIDS are known as opportunistic infections, and they are open to getting illnesses and diseases a lot faster and quicker than normal people would. Within this stage, they are still considered highly contagious. Next slide. Anyone is susceptible to get HIV. There's a lot of ways that you can get HIV, from sexually transmitted, from pregnancy passed off to an offspring, or sharing needles, or even breastfeeding. I'm going to pass you off to Kelsey, and she's going to continue on with our presentation.
So I'll be talking about the risk factors for HIV, and the highest percentage is from unprotected sex, especially from male-to-male sexual conduct, also using and resharing needles, and lastly, African Americans and Hispanics are more likely to contract HIV than any other ethnic group due to the lack of education and access to healthcare, including poverty. Next slide. In terms of HIV or AIDS in the United States, the average number of new HIV infections between 2015 to 2019 was found to be 36,680. Also, the HIV incidence from 2015 to 2019 declined by 8%, and at the end of 2019, the estimated number of HIV infection has went down to 34,800. Next slide. Lastly, the prevalence and mortality in 2019. So for prevalence, which means the amount of people who have the disease, is approximately 1.2 million people. And the mortality, which is the amount of people who have died with HIV infection, which is about 15,815. Next slide. Next, I'll be talking about the pathogenesis of HIV, which are the clinical signs and symptoms that vary depending on the stage or phase of infection, as of what Liz spoke about earlier. Knowing the stages, which is acute, chronic, and the most severe stage being AIDS. I'll be talking about acute infection a little bit, which starts to develop flu-like symptoms that last 2 to 4 weeks. Symptoms can be fairly mild or not shown at all, and the viral load is at its highest. For chronic HIV infection, the virus continues to multiply and will last years if treatment is not administered early to reduce severity. Both acute and chronic have similar symptoms, which are fever, weight loss, swollen lymph nodes being the very first sign that you see, and diarrhea. Next slide. Next, I'll be talking about the disease progression. So if HIV doesn't get treated, it could lead to AIDS. What happens specifically is the virus attaches itself to CD4 cells, which are on the surface, and slowly damages and decline your population of T cells, and you become very weak. The major body symptoms that get affected, which are out of 5, first being respiratory, you can get pneumonia or lung cancer. Second, cardiovascular, which deals with high blood pressure and heart failure. Third being the digestive system, where you can get oral thrush, which is a white patch on the tongue, which is a fungal infection, and a salmonella infection, which causes diarrhea. Fourth being the central nervous system. It's not completely understood, but can cause nerve damage and also associated dementia, which affects cognitive function. Fifth being the integumentary system. You can get shingles, which is a form of chickenpox, or which involves an outbreak of bumps on the skin. Next slide. Next, I'll be talking about the diagnostic tests that are available. So the first one is the NAT, which is a nucleic acid test, and they're looking specifically for the virus, and it is detected within 10 to 30 days after exposure. The antigen and / antibody test, you can get it as a finger prick, an oral, or just taking blood intravenous. And the detection is within 23 to 90 days after exposure. Next slide.
To continue, my name is Laura, and to continue off of what Kelsey said, late diagnosis is a major challenge for the control and prevention of AIDS in the world. People who are exposed to the virus need to get tested immediately. Although it takes the body 6 weeks up to a year for antibodies to be developed for the virus, late diagnosis of HIV infections will increase the risk of transmission to others. Prognosis. The study published in the CDC weekly report shows from 2010 to 2017, the HIV-related death declined by 48%. By 2020, which was just last year, 90% of all people receiving antiretroviral therapy, aka ART, will have viral suppression. Will there ever be a cure? Researchers believe we can find a cure for HIV. We do know a lot about it, but for right now, antiretroviral therapy treatment is the only medication that's effective. Public health issues. HIV and AIDS impact communities all around the world. It attacks human cells called T cells when it enters the body. It causes the body to become defenseless, and it causes the body to become defenseless and vulnerable to illnesses that they may once have otherwise fought off so easily. HIV can be spread in 3 ways. 1, through unprotected sex, 2, through the blood, and 3, from mother to child. Public health issues and zoonotic concerns. Some of these infections are zoonotic that are naturally transmitted between animals and humans. There aren't many reports of the disease being transmitted to animals. Most of the incidents that are reported are occurring among humans. Treatment. Unfortunately, as stated before, there is no cure for this disease. By There is no cure for this disease, but there are treatments that can prolong one's life if they're suffering from HIV and AIDS. An example of a treatment would be antiviral retro treatment. If a person living with this disease doesn't take their medication regularly, the treatment will not be as effective and the HIV in their body will increase. Get check. Less than 40% of US adults have been tested for HIV. In a study, researchers found that about 39% of US adults have been tested for HIV nationwide, which is not a lot. Everyone from the ages of 13 to 64 should be tested for HIV at least once in their lives. CDC recommends. Now on to the multiple choice questions. Question number 1. What happens to the body when HIV and AIDS destroy enough T cells? A, minor infections become easier to manage. B, the body becomes more vulnerable and is defenseless to illnesses that may attack the body. C, the body becomes stronger and is able to easily fight off major and minor infections alike. D, all of the above. The correct answer is B. The body becomes more vulnerable and is defenseless to illnesses that may attack the body.
Our second question, what are the early signs and symptoms of HIV/AIDS? A, swollen lymph nodes, B, fever, C, weight loss, or D, diarrhea? The correct answer is A, swollen lymph nodes.
Lastly, we have question 3. What is the most severe stage of HIV? A, chronic HIV infection, B, acute HIV infection, C, immediate HIV infection, or D, acquired immunodeficiency syndrome? The answer would be D, acquired immunodeficiency syndrome, and that will conclude our presentation today.